Welcome back to the Oral Health Podcast. Now, yesterday when we were talking to Dr. Sandra White, she did rightly point out that we had not yet discussed the issue of mental health within dentistry. Now, that is exactly what we're going to do today. Now, I've been joined by Dr. Rob Chaffe, who is going to sit down and have a chat about his experiences with mental health within dentistry and how he takes steps to overcome the daily struggles that he still goes through, and also shares some experience with mental ill health that he had during his teenage years. Now, we do get into quite a frank discussion about mental health in this episode, so if that's not something that you're comfortable listening to, then please come back for another episode another day. So, Rob, do you want to just take a second to introduce yourself?
Yeah, sure. Hi, everyone. I'm Rob. I'm a dentist. I work in London. I we talked about with Sophie, I work with Align technology quite a lot. So I do a lot of Invisalign. I work in private practice. I'm studying at the minute for an endo masters in Liverpool, which is another thing I like to do. And again, more from mental health point of view, I was realized during lockdown and wearing all that PPE that you just want to do treatments that make you relax. So I just find sitting there doing a root canal for 2 hours is actually quite relaxing for me. I don't think it's the same for the patient, but for me, I find it quite chilled. So I just put my tunes on and go. And so yeah, I'm just trying to do things that that I enjoy. So I do that. I wanted to talk about mental health because of some experiences I've had in the past. I've wrote some articles on it, especially talking about mental health in male dentists. So a lot of us as men are not as good at talking as maybe I like to talk, but it's just trying to encourage people to sort of find their voice, having problems, talk about it, don't be scared, and things like that, really.
So do you want to take a second to talk about your own experiences with mental health, just in as much detail as you want to?
Yeah, cool. So when I was younger, I was about 16, I suffered with anorexia. At the time, I was doing well in school. I was quite good with sport, but I got some injuries, some bad things happened in my life. I just didn't handle it particularly well. And yeah, it took me to a really bad place and I nearly died as a result. And just to see on reflection what that A did to myself, B did to my family and my friends, especially as teenagers. Like now I'm a dad myself, I can reflect on it more, but gosh, what have I done to how much my parents must have felt, and the impact of that. So now I've got over all that 30 years later, and I'm getting very old now, but you kind of want to give back. So it just encouraged me to write about having my eating disorder when I was younger and how these things don't have to be carried with you for the rest of your life as a negative. You can learn, like we do in our practice. You can have an experience but learn from it and then use that to kind of hopefully help others that feel like they're really trapped, can't have any help, and there's always is someone there for you. It's just about learning to talk about it, find the right people, have a good community around you, and that experience just inspired me, especially with lockdown. And I was chatting with Sophie before about, I watched a documentary about Andrew Flintoff, the England cricketer, and his experiences with bulimia, and his experience is so negative. I was like, well, I wanted to flip it on its head and be like, well, actually, as a male professional who suffered with something, I don't want my kids to see, or my friends and people in my community to see that this is so negative. I've had this and it can be positive. It's horrible at the time and you just got to learn from it and then try to avoid yourself going there. And the good thing is when you seek help, they give you tools to learn. And when you experience those thoughts and feelings, to kind of use the skills they give you to get better and not go back to that place again. So that's why it's really important to talk. Don't just put this in a corner and forget about it. Get help that you need. And you're never penalized by anyone, or anything. If you have a problem, don't believe what you read or don't believe what my friend Joe Blogg says. Just if you need help, get it, and as dentists, we see how many patients are suffering with depression at the moment, how many patients are on anxiety medications or depression medications because of what's happened to the world in the last 2 or 3 years has really affected that. So my whole purpose of trying to get involved with mental health in dentistry is to make sure as dentists we look after our mental health, use my experiences to try and get people talking about it and find a voice for us so we don't just feel trapped in our surgeries all the time with no hope of getting out and that sort of feeling, really.
Mm-hmm. So when we were having a bit of a chat before we started today, we were talking about the added pressures of working in the dental field, as well as the amount of extra burdens you maybe have to take. Can you just talk a little bit about like maybe specific mental health difficulties or challenges someone who works in dentistry might be more prone to, or
And I think I can just describe it as it's a roller coaster. And I think most dentists would advocate that most days are generally, there is a little bit of a roller coaster. Some days it's like the Big Dipper, and then other days it's actually, oh, it's like the teacups today. It's not so bad, it's pretty chilled. But the difficulty we've always got is that as groups of people in our practice, there's always like reception trying to hurry us up. And then we've got the pressures of doing like the best work we can do. We've got financial pressures. So we want to make sure we're earning enough money for either ourselves or our clinics, but still provide a good standard of care that justifies that patient's fee. And being a perfectionist myself, which is probably why I got myself into the situation I did when I was younger, is trying to use that perfectionism to be like, well, just don't let it overwhelm you. Because most dentists, as we always did pretty well in school, or even like nurses are very successful at what they do, and as well as hygienists and therapists, they were all had that mindset of being a perfectionist. And it's about trying to use that to your advantage rather than making it a stressor. Because during the day, there's so many little things that can happen. And I work privately, so I'm on a different level of stress from targets than what, say, an NHS dentist would be. Well, I know when you get to sort of February, March time, it's not a fun time for an NHS dentist because you're on that trying to hit your targets. And it can, I have a feeling, and it's something that I used to speak a lot about or be aware of, just being trapped in a surgery on your treadmill. A lot of surgeons working in London don't have any external lighting, so you're in a box all day long. You sometimes working through your lunch. You don't get outside. You don't do any steps. It's a sedentary job. You sat on your chair. You get up. You'll go to the loo, or you'll call the patient in, or you'll get up just to grab something here or there. But in general, you're kind of not moving around too much. So all of those things together provide all these sorts of stresses during the day. And it's about trying to manage those in a way that makes you feel better. And the way I've kind of worked it out was that I cycle to work. So I kind of go into work and I feel like pumped, ready for the day. I'm like full of endorphins at this point. So I'm like, right, let's go, let's get some dentistry. And then and it peps your team up, I think, as well. If you come in with a positive mindset, your nurse thinks, oh, Rob's on it today. We're going to have a really good day. I think if you come in and you're like, oh, another day at work, and you don't have that passion because you're so trapped and stressed, I think it affects your whole team, and then it will make that worse. So it's just about trying to break those cycles. And it was like almost like walking a little bit further in the morning, especially in the summertime. Like at the moment, it's light in the morning, it's light in the evening. It's not like we're in winter and it's like you dark all the time as well as all of the other stuff. So it's just trying to get out, see some fresh air, have some steps, like start getting I find that those step counters are quite good for people. So you can see, oh, I should try and do like about 5 to 10,000 steps a day. Let's just get out, do some walking. Just have a little look at your watch and see, oh gosh, I've not really moved around today. I probably really should get out and do that. And you'd be surprised how much better you feel just by like doing a bit more walking every day. And even like, rather than taking the lift, walk up the stairs, or little things like that just really help. And I just find hearing the birds is quite a nice one. I like it at this time of year. It kind of puts me in a good mood cycling in. I'm like, oh yeah, it's the birds. I'm not getting rained on. It's quite nice. So yeah, they're the sort of, I think, the stresses and how I try and manage mine. I mean, I'm not perfect. I'm like everybody else. Like, when you're running 15 minutes late and your receptionist is getting annoyed with you, it's very stressful, and you're not meaning to, we're always trying to do our best, but it does get to us, as it gets to the receptionists. And it can be stressful, as it can be all the other pressures, especially in like the current world where energy bills are rising faster than we can all keep up with. Our prices aren't going up to meet those demands, especially if you're working on the NHS. It is stressful, but it's just trying to like enjoy your job, do the best you can be, but have a nice time doing it and not getting stressed about it. And that's kind of what I try and do.
For like, just from picking up what you were saying, it sounds like people that work in dental are very prone to burnout. It sounds like quite
100%.
Honestly, it sounds like such a challenging vocation for so many reasons, but then also the impact it actually has on you, rather than like once you've actually got there and done the work to do it.
Well, I think this is what I think everyone chases in life, is the work-life balance, isn't it? Like, we're all, like, no matter what profession you're doing, you're always like, I want to do a bit of exercise and want to look good because I'm going on holiday. So, and I want to do this and I want to do that. I want to be good at my job and I want to be successful and I want to earn some money. I want to send my kids to the best school I can. And so we always create our own pressures anyway. I don't know. It's really difficult one, isn't it? But I think work-life balance is trying to manage that is always a challenge. But I think taking regular breaks is always important, isn't it? Like, working out a way to fit that in. Holidays, especially like the last 2 years, we haven't been able to take holidays. I think that's really important, to try and take holidays where you can. Provides its own stress sometimes, especially at the moment with all these tests and travel disruptions and whatever. But I mean, it's just trying to just wind down, unplug slightly. But going back to what I said I did before, I think people should, like, dentistry, it is a stressful job, maybe more stressful than the average person in the street or lay person would believe it to be. But you actually can really enjoy your job. Like, we're here talking about mental health, and I think we talk about it a lot because we're talking about negative things, like, where we see a lot of people are struggling and everything. Well, sometimes, and it's the way I try and look at life, is like, we'll try and flip it on its head and be like, well, actually, yeah, it is a struggle sometimes, and it does all get on top of all of us. But it's flipping it around, but like, well, actually, I can really enjoy my job because I really like doing these treatments. So I'm going to go on a few courses and learn how to be really good at these treatments. And then I'm going to, like, take that to work. I'm going to buy all this nice equipment. So now I'm going to do this really nice filling today, get my posh stuff out. I'm going to, like, make it look incredible and be, like, really proud of that. Then I'll show the patient, and they might not appreciate it, but you know what? You'll, like, look at that and be like, I did that, and I'm chuffed I've done that. And then the way I try and do it is, when I do filling, like white fillings on back teeth, I always think in my mind, the dentist, when she goes to the dentist, does a checkup, they can't see it and they can't chart it. That's kind of things like that I try and do, just to kind of, like, make me feel like I'm better. And there's so many good courses out there now to kind of give you that. And there's some really good, inspiring teachers. Like, on social media, there's some really inspiring dentists to see, and, like, be like, well, if they can do it, why can't I? And a lot of the time, they probably felt exactly the same at some point and was like, well, actually, I need a light bulb moment here, and I'm going to go and learn something. And same with, like, root canals. I didn't really think 10 years ago when I qualified I'd become, like, a dentist with specialist interest in root canals. And a lot of people are like, Rob, you do, like, smile designs and Invisalign. Why are you doing root canals? And it's like, well, because I really enjoy it. And it just gives you that mental break. So I can then take an X-ray after I've done a root canal. I'm like, yeah, it looks pretty good, doesn't it? And sometimes they're really challenging, which provides its own stresses. And the more you go down the rabbit hole of dentistry and you go to a different level, you open up another can of worms, which provides its own stress. But you keep learning and you just find the passion to actually enjoy your job. And I think if you can get to that place, it's actually a really nice place. If you're working, like, in NHS practice, just because you're doing amalgams a lot doesn't mean you can't do nice amalgams. Or if you then want to learn and do, like, composites, you can start doing them more privately and become really confident and actually say to your patient, well, I went on this really good course and I learned this really good technique, and all these, like, private dentists are doing it, like, in all these places, but actually I can do it for you. I love it. Like, would you like it? And a lot of them will just buy into your passion, and then your work-life balance will improve because you're doing better stuff, you're happier, and your patients are happier, and it just all works synergistically together.
Yeah, and I think you can kind of take that advice and apply it to anything. Like, we're saying, like, be proud of the things that you're doing and really go, oh, well, yeah, I know I did a really good job there. I can feel good about that. And you've got to sometimes hang on to the small victories. Yeah.
Yeah, little wins, exactly. And it's like, even like when you're baking something for your kids, or you're like, I want them to really like this cake. I just want them to eat it this time, and because they usually throw it back at me, and I'm going to make it look amazing or whatever. You just have that little bit of every little thing that you do, just because you can, like, it's always going to be difficult to be the best. That's another thing I found when I went to university. I found quite overwhelming was that I went through school and I'd always be, like, top of the class. Then I go into this environment with all these people who are exactly the same, if not better. And then you're trying to learn a different way of learning because you're spoon-fed in school. They just say, learn this, learn that, and then you'll pass the exams, which is what happens. You go to university and it's more problem-based learning, and you're like, you go into all these lectures and you sit in exams 6 months later, and you've been going out and having loads of fun, and you're like, oh, okay, I'm really out of my depth now. So I understand why students get really overwhelmed.
Mm-hmm.
And And it is the same with life. You then like see all these people posting amazing dentistry online. You're like, oh my God, they're so much better than me. I feel rubbish. And it's just flipping it. And it's like, well, it's not like that. They're just doing that to try and inspire others and showcase their work to patients. And some people like that do that are only showing their best ones. They're not showing all of the ones that they do. So it's knowing that information and not using it as a, oh, well, I'm not very good then, am I? And I do that sometimes. Like I look at it and I'm like, oh, I'm not as good as my mate down the road that keeps posting these amazing things. And I feel like really bad about myself today. But it's actually, he's not doing it for that reason. He's doing it because he wants to inspire people and show people like, look, I'm just this guy that went to university, learned to be a dentist, and now I can do this. You can learn to do it too. And ask me about it if you want to. And I've gone on this guy's course or that guy's course or that lady's course. And because a lot of it is just learning techniques and systems, which we now like teach on, which is great.
We spoke a little bit about some of the negative side of mental health, and I fully appreciate everything you're saying with turn it on its head, make it as positive as you can do, because it at the end of the day, that's probably the best way to get through it if you are having a bad time, is take all those things that you can turn positive and turn it positive where you can. If we can sidestep slightly, can we talk a little bit about some of your experiences with dentists who have reached out to you and spoke about some of the ways that working in dentistry has affected them mentally, and like what's been the general consensus from the people that you've spoke to? I know
I mean, I think I kind of touched on it a little bit before. I think with dental students, I think dental students go through a lot of stress. And I wrote an article recently about how I had a GDC complaint from a checkup, and I had the 4 months of absolute anxiety and stress. I felt I couldn't do my job. I felt like I've done something. So if it's a checkup for like, how can I not meet this person's standards from a checkup? Like, I thought I was like, I've done implants before, I've done all these big cases, I'm like, it's going to be one of these. And then I found out it was a checkup. I was like, it blew my mind. And I just thought there's something so fundamentally wrong with my diagnosis or communication skills, because I thought I went over and above for this in this case. Like literally I went so far for this person, and it just really affected me. And at the end, it was found that I'd done nothing wrong, which was great. And I got a really nice reply from the GDC saying, I'm really sorry you had to go through all of that. So there is a degree of empathy with the GDC. They are there. It's just very cloak and dagger how they operate, which I think is what produces this anxiety amongst our profession. But because of the experience I went through, I wrote about it, and it's out there if anyone wants to read it. It's the links on my social media page if anyone wants to check it out. But it's really interesting because the GDC have actually commented on it, and there are things that they're looking at regarding this, which I think is really interesting. But it pointed a lot of students in my direction, like dental students who are going through a lot of anxiety. I think when you go to university for the first time, I spoke about how you go from being like really good at school, and then you go into university and you're with all these other people that are pretty much the same if not better than you, and that's really overwhelming as an emotion anyway. And trying to handle that is hard. Then you go from having to learn things completely differently. You go from being the best, and then you often fail a few exams along the way as you learn how to manage that. That's overwhelming. You're away from home. You've got no family there to give you a hug when you're having a bad day. Breakfast isn't made for you. All these little things that we take for granted as kids, adolescents, and teenagers, we don't have. We've got to kind of wing it all ourselves. And it's so overwhelming. So the amount of feedback I had on that article from students was like actually quite overwhelming for me. And I just sat in my garden with my kids being like, God, I don't want my kids to feel this way. Like we can't let this carry on. So I think it's really good that people are talking about it, hence why I wanted to do this. And I'm very passionate about it because it can't carry on. This is the way mental health is. It's improving in society. I think personally, our profession is left behind. I really do. There's not enough done about it. And I know a few people who are in jobs at the tops of organizations in dentistry feel the same. And they're trying to then, in their organizations and their members, because a lot of it is membership based, which is another annoyance with our profession, that they're trying to then improve things. So it's just trying to open up mental health in our profession to everybody, whether you're a student, whether you're a dentist. And we also had dentists contacting me saying they went through similar experiences, like, they had checkups and had end up at the GDC. And I'm like, in my mind, I'm like, how is this even possible? And when you go through those sorts of issues, it's really hard at home, because like I'm married to a non-dentist, so my partner at the didn't understand the stress. She's like, believe in the system, believe in yourself. And like, it's exactly what Sophie just said, like, yeah, flip it upside down. It's like positivity, but sometimes you can't get there. It is really difficult to get there. But my wife was right, because I was proven that nothing was wrong. But when you're stuck in that rabbit hole of like self-loathing, fear, it's horrid. And there's no one there for you, because you don't talk to your mates about it, because they're like, well, I look like I'm not very good, and why don't I tell my friend, because then you'll then judge me, and I don't want to tell my other friends that aren't dentists, because they won't understand, and you end up not talking to anyone. So I kind of, in my life, kind of like was a little bit out of control for a while, but it happens to all of us. Even like me, it's like someone trying to talk about mental health and what I learned about it. We still have struggles. It's amazing how it affects everyone. Like these things, the GDC, the pressures of being perfect in the eyes of the GDC patients, being the perfect student, being the perfect, everything. It's very challenging. It's a tricky one, but lots of people have reached out, and it is incredible how many people are undergoing stress in our profession, and they're scared to talk about it because of the fear of like being told, sorry, the GDC are there, you better not say anything. And it's actually not the case. And it's just frightening, really.
I can't imagine how much stress it must put on a person, and then having that limbo as well, where you don't know what the outcome's going to be, and carrying that around. It's not something someone should have to go through, unless it's very, 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 for something simple. You shouldn't need to be put through something like that.
No, and I do believe like the GDC is a great organization, and I think that they have a really challenging job to do. And that, I mean, I don't know statistically how many numbers of complaints they have. I would probably assume that they've increased over the last 2 years. Like the first year post lockdown, everyone was kind of relaxed and was like, well, yeah, we're just lucky to have you guys. Whereas now it's kind of like the patience has ran out, and I think the complaints have gone up. People's stress have gone up, and then it's pushing everything else that's going on in the world. Stress has gone up. So it's like we're in that stress pot, really, aren't we? And that's whether that's patients going to organisations like the GDC because they're just so impatient, they're just so annoyed, and their life has caught up with them. And I think that hopefully, as time moves on, this will change. But it's a societal thing maybe as well, not just a sort of institutional thing.
For anyone that maybe is listening and has realized that some of that resonates with them, what are some bits of advice? I know you've given quite a bit, but is there any I don't know, any organizations that can help with these specific types of like stress, burnout, and or is it like, where would you point someone if someone came to you for?
That's a really good question, because it's not very well documented, is it? I think, again, in our profession, it's not well documented. As I said earlier, I think we've been really left behind. And I think one thing I kind of want to really push with is to try and see if we can improve things. So I think the first point of call is always just talk to like a colleague or someone that you trust. If you don't want to do that, these days people forget how good social media is. The key word in it is social. It's not just media, it's not just marketing. There'll be someone that you can talk to, even if you don't know them. Like I've had people message me about mental health now, and I can help people with that. So you can message people. Then there's some good organizations. So I think the main one is the BDA Benevolent Fund. And again, it's a company that's not really well known, and it's a charity basically. And their aim is just to support people in dentistry. You don't have to be a dentist necessarily. You can just call them up and be like, can I have some help, please? I'm struggling with this. Then they can help triage you to where you need to go. I did the London Marathon for them a few years ago. Well, actually, last year. They do a lot of good things. It's not a well-known organization. And because of its name, people think, oh, I have to be a BDA member to get their help. And you don't. You can just literally Google them, contact them, and they will help you. It is a pure charity. And it's an old charity that's changing. So it's evolving. So I got quite involved. They wanted me to be a stakeholder, but I just didn't have the time. And what they want to do is to try and make it more accessible to younger people. So that you'll see, if you follow them on Facebook or Instagram, they're doing a lot more content now. So they're trying to reach out to more people, so people know they're there. So that's a supportive call for dentists. It's a really good place to go. Sometimes though, you're in crisis and there's no one to turn to. So there's always, like, and the BDA benevolent fund told me this, always the Samaritans. That's always there for people. Just give them a call. One of my colleagues worked for them during lockdown, and she found it very inspiring. So I think there are a lot of people, and nice people, there to support. I think that, and also you've got, like, if you're feeling down and anxious, you can always go to your GP, and talk to a professional, because often, the world is stressful right now. Our generation's been dealt a bit of a hard deal. Like, we've dodged, like, world wars and things like that, which is great for, like, from grandparents, generations, which would have been absolutely 100% woeful and horrid. But I think we've had a lot of, like, ups and downs and recessions and COVID and more recessions and more, all these sorts of financial pressures. Like, the cost of living is rising faster than it has since about the 80s. So we're kind of hitting that. And so I think we've had a bit of a tough time over the last few years, and it's understandable that, it's affecting us. So just kind of getting help with that, really. And from my experiences as well, when I had anorexia, the best thing for me ever was counselling. Like, I had to get myself over the acute problem. I don't think, it depends on what situation you find yourself in. If you're in an acute phase of, like, of whatever you're going through, you've got to seek medical help. Like, the BDA benevolent fund won't be able to help you with that. And so the Samaritans will maybe talk to you, but they won't be able to help you. You've got to sometimes just pick up the phone. And getting to a GP these days isn't always easy. So that also is difficult with fitting in around work. But I think sometimes just take a day off, just phone in sick and be like, right, I've got to look after myself here. And just do it. Like, turn up at there at 8 a.m. and be like, can someone see me today? I need to speak to somebody. And they will do that. The GPs will do that.
Yeah.
And get through the acute phase. And then once you get through that, the support phase with, like, counseling is amazing. Like, it's all about learning to talk, recognize, give you the tools. It's like everything in life, you give you these tools to deal with those situations, because you're always going to get stressed. And you're gonna have kids, you're like, God, every day seems to be stressful. Like, it's crazy. I don't know how I'm here. Like, I can barely do my own shoelaces half the time. I never look in the mirror these days because I don't have time. When I've got my kids running around, it's like madness. So it's there's always something, isn't there? And I think that life is just stressful. It's about having the tools in yourself to be like, right, I'm going to turn that glass from being half empty today to half full, and learn to flip it on its head. And you can't always do it, but then you just know you have the tools to then manage those really dark days when you have a dark feeling. Right, no, that's stupid. Now I'm a dad, I'm a parent. What would my kids say? I've got to set an example to my children. I set an example to my colleagues. I'm getting so old. I'm the senior dentist in our practice. I'm like, right, no, I can't be the one that's turning up, and being mean and or whatever. I have a responsibility to be as good as I can be, and I need to lead by example, because with it in life, you just somehow, a lot of I might find, like, my parents or in-laws would always say, you just got to get on with it. Come on, just get on with it. Like, what's wrong with you? Like, shake you a little bit. Like, come on, that's what we had to do. You just get on with it. I think, well, it's not quite like that now. I think you need to kind of learn how to handle that, and then once you've learned those tools, you can be like, well, yeah, now I can just shake myself off a bit. But you've got to get to that point in your life when you learn how to manage that, and it's hard. It's hard.
Yeah, but I think that's some really, really good advice. And yeah, the Samaritans are a brilliant organization. They're fantastic. But like you said, there's not really a substitute for going and seeing a GP in some cases, which
Yeah.
If you've got to go and see your doctor, go and see your doctor. There's
always someone that can help you. Whether it's your mum, dad, colleague. So I said to the day off, just take it off. If you're in a bad place, just take the day off.
Mm-hmm.
Get your head, get yourself organised, and then go back in the following day, hopefully feeling better than you did when you made that phone call or when you turned up at your GP.
Yeah.
And that's the way. You just got to kind of break it into baby steps, little baby chunks.
Mm-hmm.
I did the same with you said burnout and earlier, and I think it's a really good word, because burnout, I think, is mental and physical. And I think mentally we get burnt out so easy. And the way I kind of break mental burnout down is taking each thing into little chunks. Like I work at some 12-hour shifts, and I just break my day up into little chunks. That's what I do with my marathon training. I'm like, right, okay, it's an overwhelming job I've got to do, and all this training's overwhelming. I've just got to break it into chunks and build them up. But you've got to be careful with the physical burnout as well, because I find cycling a lot or walking a lot, or then increasing your exercise to try and feel better, can cause burnout because you're doing too much. So you've got to take it slow. Always listen to your body. As I said, don't be scared to take a day off work.
Mm-hmm.
We all need it sometimes. It might create its own stress, but patients cancel all the time. Come on, if you're in work and in a bad place, you're not going to do a good job for those people. Just sometimes take a day for yourself. Don't do it all the time, because that's not professional. But if it's very important,
Mm-hmm.
get your ducks in a row. And the good thing is there was always someone there for you. There always will be. It's just remembering that and finding the one that you feel comfortable with.
Yeah. On the note of taking a day off and taking some time for yourself, I'm going to let you get on with the rest of your day, because I have interrupted your day off.
Oh, that's cool.
To sit and talk to you. But it's fine. I say this a lot, but it genuinely has been a really insightful conversation. I think some really, really good bits of advice and perspective shared, to be frank. So I really appreciate you sitting and talking to me.
Oh, it's a pleasure. I mean, it's something I'm really passionate about, especially since I've had children as well, and seeing people talk negatively about things, it always makes me feel a bit emotional going through some of this, because being I just don't ever want my kids to feel this way.
Mm-hmm.
I don't ever want my colleagues to feel that way. I'm getting all caught up now, but it's incredible how much these things affect us, and it's just about finding a way to navigate that, so we can all get the lives we should have. We should be happy, right? You see people walking down the street, everyone seems happy. Well, they're not, but we should be happy. We should have a nice time all the time. Yeah. The world is beautiful. Our lives are beautiful. As I said, I have to go back to that thing. I like the sound of the birds. That, to me, game changer. And I hear the birds every morning. I'm like, oh, it's going to be a good day, So I appreciate the really little things in life.
Mm-hmm.
It helps me.
Dr. Rob Chaffe there talking about mental health within dentistry, and I will link all of his information as well as the organisations he's mentioned below. If you want to learn more about Smile Month, you can go to smilemonth.org. You can also follow us on social media, and if you want more bespoke oral health advice, then you can go to dentalhealth.org/dental helpline to talk to our helpline team. Thank you once again, Rob, for joining me. It's been a brilliant conversation. It's been good to talk to you. Thank you to Align Technology for linking us up with Rob, because without you, this wouldn't have been able to happen. And thank you to you as well for listening.